Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now we have to see some lines. First, Shenton's arc. Shenton's arc is actually this arc which is present. Actually, this is an arc which is connecting the pubic ramus, superior pubic ramus. This is the superior. So, right. This is an arc which is the pubic ramus. So, this is an arc which is connecting the superior pubic ramus with the medial head of neck of femur. If you see here, superior pubic ramus with the medial part of the head of the femur like this arc is actually the Shenton's arc to the medial side of the neck of the femur. So this arc-like structure is called as Shenton's arc. Okay. So here this is an arc which is going from the inferior margin of superior pubic ramus. So this is the superior pubic ramus. This is the superior pubic ramus. This is the inferior margin of superior pubic ramus to the this is the medial aspect of the neck of the femur. This is here. So this is Shenton's arc. So where is it broken? This Shenton's arc is actually broken whenever there is supratrochanteric pathology. See here the Shenton's arc is broken in supratrochanteric pathologies. Like it is broken in developmental dysplasias of hip. You will see that the Shenton's arc is broken. So this side the Shenton's arc is broken.
thank you and thank you for watching.